It is the end of November in Douekwe and the west of Cote d'Ivoire. The conflict ended several months ago, but the coming legislative elections, persistent violence and frequent land disputes are still a threat for a displaced population, still afraid to go home.
We've been hit, beaten up, killed even. That's why we fled to come to the mission. Now we are being told to go home, but living conditions there are very poor. We have no homes, no house to go back to. Everything is ruined.
Despite their concerns, these displaced people will have to leave the camp set up by the Catholic mission.
More needs to be done about security, especially in the villages and camps. That's where it's worst. It's in the forest and plantations that things are happening. It's on the roads out to the villages that the security needs to be restored.
An MSF team is working in Douekwe Hospital. Patient numbers are high because health facilities elsewhere in the region are not functioning properly. There is a shortage of medicines, and in spite of the promises made by the new government, in many places people are still being asked to pay for care.
This morning, a mother came in saying that her child had been ill for several days. She said that yesterday she went to the hospital at Bengolo, which is nearly 20 miles away, but they didn't have any medicines. She had to sleep at the hospital, outside, waiting for the first bus of the morning to come here to Douekwe Hospital, because we've got medicines here. But unfortunately, it was already too late. He had acute meningitis and didn't survive.
Bleu-les-Quines was deserted during the fighting. Life is getting back to normal, but the conflict has left its mark. The MSF team that had been working in its hospital has finally left. The organization is gradually withdrawing from health facilities where its help is no longer needed, but it is still working at the Douekwe and Thai hospitals and in a health center near Giklo.